Hello and welcome back to the Overcoming Overwhelm show. This is where we are, exploring a nervous system approach to health, wellness, and success. And today I can't wait to bring you our special guest. This is Dr. Hayley O'Neill. And let me tell you, her bio kind of speaks for itself. So let me jump into that and you'll be excited to hear what she has to share with us for obvious reasons. She's the founder of Nourished Foxy Mama, which is a total body love lifestyle transformational program. She holds academic position in Biomedical Science, has a Ph.D. in Bachelor of Science, honors in metabolism. She's completed a 5-year postdoctoral research fellowship in obesity research in Australia. She's internationally recognized authority and women's health advocate and has been at the forefront of clinical trials to better understand why women struggle to lose weight and keep it off. Through her own hands-on experience, both professionally and personally, she's identified the gaps in the system. And today she teaches her clients strategies that cut through the diet industry BS and the decades of misinformation so women can flourish in the reality of a busy life. Her mission is to help transform busy women and mamas all around the world through her groundbreaking science-backed weight management and lifestyle methods to optimize health and wellness, the nourished way. Her motto is love the way you look and live the life you want. Those things go so beautifully together. And her clients are living proof that yes, a nourished Foxy Mama can have her cake and eat it too. So how exciting, right? This is such important work. And I love the holistic approach that you take. This is not eat less, exercise more, right? Because what we know is that paradigm, like we were taught that in middle school, and had been taught for so many years that was the way. So I have so many questions for you. So it's hard for me to narrow it down. And I know we don't have, 2 or 3 days to spend on these, but let me ask you, and I've been asking a lot of the guests, nervous system work was not something that most of the guests really knew how important it was on day one in their practices. It was something that they learned how important it was. And that was my case too. I kept wondering, why are certain people not able to implement the tools, not able to really, dive into the things that they know are going to help them? What is standing in the way? And it certainly was the nervous system. So I'm curious if you could speak to that. You obviously have high level training. Did your work with the nervous system come through that, or was it somewhere else that you really understood how important the nervous system is to helping people reach their optimal weight and their vitality?
Yeah, I guess there's 2 aspects I see with the nervous system. And the first one is, I guess, just that underlying constant stress. And what when we were looking for novel sort of methods of how women diet to, not only lose weight but keep it off, one of the standout hormones was cortisol. So that's what sort of triggered my research around the relationship between stress and weight, because like many hormones, which a lot of us don't know this, is that they fluctuate throughout the day. So they're not always just constant. And a lot of them are on like a circadian rhythmicity. So they cortisol is a primary example where it peaks in the morning and then declines throughout the day, and as it's declining, then you've got an increase in melatonin, which really ties into sleep. So what with this aspect, I really wanted to look at whether there was something in that morning, cortisol response, because that's a measure of our hypothalamic pituitary axis activity. Okay, and in disease states we have blunted cortisol or chronically high cortisol. And you know, stuff around Cushing's syndrome. So this relationship between stress and weight, that's where it sort of came about around cortisol, because they, you know, Cushing's syndrome, they have excess fat around their abdominal region. They have pre-diabetes or characteristics of diabetes.
Yeah.
So that's the hormonal, you know, cortisol component of the weight loss. So I went, you know, spent quite few years looking at this, and in fact, like women with excess weight, you know, they might be healthy, but they have you know, more fat, actually had a blunted cortisol increase in the morning. And once they lost weight, this was then restored. Whether this could be a predictor of how well they do, we still like in a weight loss program, we're not sure. But then the other aspect is, you know, the considerations of when we're trying to lose weight. You see women coming in desperate, they've tried all these different latest diet fads, they're super stressed or eager or to lose weight. They don't know where to start or what they're doing wrong. You know, so there's that stress aspect.
Absolutely. Yeah. Even you talking about it, I felt like the energy of, oh my gosh, I'm in this horrible place. Get me out as quick as possible. I can't stand this one more second. Right. What a stressful existence. Right. And to always be battling your body and to be at odds with who you are.
Yeah. And how we're conditioned. So what a lot of us women don't know about when we try and lose weight. We've got a lot of components, so it's not just eat less and exercise more. So you've got I have different phases, I like to call it, of a weight loss program. And one of them, you know, you're already in a constant state of stress often. You're not eating enough. You might have stressful work home life, or things are not happening for you. So you're already got this sort of chronic low stress level. So I like to call it, so then to put someone in another stressful situation, so calorie restriction is a stress on the body, okay? So we need to calm all that down, get nourishment in, and I call this the priming for weight loss. Okay.
Oh, beautiful. Yeah. I love this. So someone comes in, they're in a state with their body that's where they're not nourishing themselves. Maybe they're taking in more calories than they need, like in say on a weekly basis, because they have those periods of heavy duty restriction, but then also periods where they're kind of overdoing it because often the heavy restriction or for whatever reason. But so you have a priming phase where
yes.
Okay. And that's a time, if I'm understanding it, where the focus is on just nourishing the body and getting the body to a place where it feels like it's being nourished, like it doesn't have to worry about the next time it's going to be fed.
Absolutely. Yeah. So when the classic pattern with women is that they skip breakfast and they might have like a coffee in the morning, they might have a little bit for lunch, or, you know, so I always say you're skipping breakfast to save on calories. Then, you know, gets to the afternoon and it's like, oh, I'm really tired. I'll have a chocolate bar, or I've been so good all day. Or you get home, you have a glass of wine, you eat everything inside, and then that goes into the evening. And what's that is doing? Number one, what you just completely exhausted all day, brain fog and fatigue. But then it starts affecting, you know, so your energy levels, because you're not getting in enough calories to regulate those blood sugar levels. Then in the evening, when you should be sleeping, you're then having more sugar or alcohol or things snacking in the night, and then that affects your sleep. And then it's, you have a crap night's sleep, you wake up in the morning, you're tired, and the cycle repeats. So it's about bringing things back into a nice rhythm, getting consistency with meal timing, because there's a lot of stuff around this now on meal timing, and also the size of your meals in the morning versus the evening, and how that can help with hunger and satiety and support, not only balancing energy and mood, but also reducing those cravings. So yes, so that's the first sort of phase, is
Let
just
me
bring
ask
everything
you,
back down. Yeah.
just because it's such a hot topic these days, and I have my own thoughts on it, but when you talk about that, so many people are being introduced right now to intermittent fasting, which very often would, indicate don't eat in the morning, wait until later in the day. Intermittent fasting meaning try to consume all of your calories within a smaller window, whether that's, 8 or 10 or 12 hours, and then fasting for 12 hours. And I know a lot of people are avoiding breakfast in order to intermittent fast. And like I said, I have my thoughts about it, but I'd love to hear from you on what your thoughts are on that as a regular practice.
Yeah, so I'm very familiar with intermittent fasting and the regime, the science around that. It has a lot of metabolic benefits, and what I mean by that is, on lipid levels, or just, activating your metabolism and getting things sort of firing, because basically we've adapted over the last few decades that we're constantly grazing the whole day, sometimes even 16 hours or more.
Yeah.
And what intermittent fasting does, like, yes, it has a lot of metabolic benefits. They originally were doing research on cancer, and they found every time they did this intervention that the mice lost weight. So that's where the history of it came from. In terms of women and weight, people do find it easier to eat within a certain time window and then not be restricting their food. So that's where the benefits can come, and that's what can sometimes drive the weight loss. But overall, the scientific evidence isn't that strong in terms of greater weight loss compared to another dietary intervention. We don't know the really long-term outcomes, but in terms of health or safety or things like that, often a lot of interventions can be super restrictive, or people just fall over and can't consistently stick at it. Usually beyond a month, it starts getting a bit more stricter. I believe that for women that it's important to have breakfast, and yes, you are more sensitive and stuff to carbs in the morning, but by tailoring your meals, as there's evidence coming out now around having a larger meal for breakfast, and how that can help improve or reduce hunger and increase satiety throughout the day, so you're less likely to get those cravings. Hormonally, there was some evidence with intermittent fasting that it could lead to regular menstrual cycles and potentially infertility and things like that. I don't think the evidence, they need to do a bit more around this, but definitely I see reduced cravings and improved energy when you're getting consistency with those meal timings, gut issues as well, because you've got that opportunity to get more fiber into your diet throughout the day. So yeah.
And so many of these things, my approach with intermittent fasting and so many of the other things is, there's not one size fits all for people. No. And especially people with more delicate nervous systems, that may not be the best time, right, to start something like that, because it is a stressor for the body. And it may be that sometimes for some people in the right situation, that stressor helps them become more strong, helps them clean up their body, turn on, microphage and things like that. But we should never take anything that's out there and just say, oh, Intermittent fasting, that's going to be the key, right? The magic bullet for me to be able to lose weight and get healthy. Well, we don't know.
Yes.
It's okay to try some things on, but never going into it feeling like, this is the answer for me, because all of us are different, and we're in different phases of our lives, and our bodies may have different needs. So, I love this idea of allowing food, right, to become nourished as opposed to restrictive, and you giving people the permission to eat breakfast, to prescribe eating breakfast. What a beautiful thing. And we get to try it, right? We get to try both things. So I love that as the first phase. So take us through the next phases for people. We're primed now, we're fueling our bodies, we're nourishing them. What's the next step?
Yeah. So when we enter into the weight loss phase, so that's when, you can lose weight by various means. And, this can sometimes, after that nourishment phase, it really can mess with people's head, because they're like, oh my goodness, I'm eating so much food, but I'm not gaining weight. And they checking their weight, on a daily basis. And they're like, oh my, so it really does, play with your head a little bit.
Yeah.
So then when we go into the weight loss phase, and everyone's energy maintenance requirements are different.
Yeah.
As soon as we start restricting the calories, because in order to drive weight loss, you need to create a deficit in the amount of energy that you're eating. That's just physiology.
Yeah.
How each individual responds to that. We know that over time, the variation from one individual to another in the amount of weight that they lose, whether that's through diet or surgical weight loss, it can vary quite a bit. And then it's not just often it's not just compliance. We're writing a whole review on this because we're looking at the genetic component of weight loss. And yes, genetics do play a role, even up to 40 to 70% variability in someone's body mass index can be attributed to genetics. But we've also got adaptive responses going on in the body. Okay, so what I mean by that is hormonal changes, neuroendocrine hormones, which are driving appetite, driving hunger, which make you want, drive up these cravings. So often when you start losing weight, you're going really well, and then everything just falls over. And there's good reasons for that. And that's because hormonal changes, stress hormones can be potentially going up. We were quite surprised that they don't go up acutely that quick in response to calorie restriction. So you start losing weight, you have all these changes, you get a drop in your metabolic rate, which can contribute to slowing your weight loss and then encouraging that regain. So first phase is the primary, the second is the diet phase or the weight loss phase. Then after that, so obviously there's lots of different components that feed into that. Stress is one of them, and self-care, sleep, hunger cues, shifting the goal from not just weight, but being healthier is really, really critical. And that's a big mindset shift for a lot of people, because we grow up in a culture where we are so focused on numbers and weight.
Absolutely. Yeah. But what a beautiful shift. And it sounds so subtle, but it's actually incredibly meaningful when I shift the focus from I'm broken, I need to fix something that's wrong with me, right? To I want to grow my health, right? I want to take care of myself because I love myself and want to take care of myself. It's the most subtle shift, but the behavior is so much easier, right? To carry forward to when you're coming at it from this positive place of wanting to take care of something you love versus needing to fix something that's broken.
Well, this is the thing. And I say, like, so many women feel like a failure. This hasn't worked for me before, or the fear of, what happens, they say to me, what happens if this doesn't work for me? Because I'd be happy if I could lose like 1 kilo or this, or, I eat really healthy, but what am I, I don't think I'm doing anything wrong. Is it just because I'm getting older? Like, all these things come in.
Yeah.
But it comes down at the end of the day to having that accountability and that support, and obviously someone who knows what they're doing, the latest science. And it's not just a low-calorie meal plan, but tailoring it in such a way that it's going to support cravings. It's going to boost energy. You're getting enough fiber to support gut health, and many other benefits in the body. But step by step, yes, you're working on a program, but you're giving the person flexibility so that it's sustainable in the long term. So there's no point in giving people food and say, follow this, if they don't like that, or they're having to give up the foods they love, the chocolate or the wine, or, nuts or things, chips. Like, I leave all that in. And then the more you eat healthy, then your taste changes as well. And a lot of the women say, I don't even feel like that anymore.
Right.
So,
yeah. Because so often it's the deficit that is driving the cravings. And so you fix the deficit, and then you're in a space where you're not having to deal with that, not having to control yourself. It's just kind of naturally where your body takes you when you're treating it right.
Absolutely.
I love that.
Yes.
So the second phase, the weight loss phase, which has to be, flexible and
sustainable.
Sustainable. Yeah. What comes after that?
So in weight loss, so we have the diet after the diet. So this is where a lot of people fall down, because once they've lost the weight, great. I always say that's the easy part, is losing the weight, and we can get it off in all different types of ways.
Sure.
But it's about integrating it into our lifestyle. How do we see our life, in the future? We want to be able to go out for dinner and not be restricted, choose anything off the menu. So the second phase, usually because women are feeling by this stage more confident, they're seeing good progress, they're eating healthier, they're confident in the kitchen because, they're doing their meal prep, and they've learned lots of different tips on how to do it with, spending only an hour or two. Mixing and matching foods. They're starting to know their body triggers, and can regulate their weight in that way. But also wanting to get back into exercise, the gym, that the goals change, new job, all these things. Like, when you're feeling good about yourself, you're wanting to take on new challenges. So I often see that pattern, that they're wanting to get more active, but it's not overdoing it with, I think, with the exercise as well, because you don't want to put too much pressure on yourself. This perfectionism, I'm going to be going to the gym now 5 days a week, and then when you're not making those, or achieving those goals, everything else falls down. So when we move out of when we've lost the weight, that maintenance and preventing regain phase, yes, being more active does come into play, because you're trying to keep your muscle healthy, and you don't want to lose muscle, keep the metabolic rate up, and also putting support things in place for yourself. And self-care is a major one. Managing stress, keeping the eating consistent, because that all ties into hormones, energy, mood. So that comes up. And also investing in yourself to have that ongoing support, because we know with lifestyle interventions, as little as like 8% body weight loss, people are regaining it with 2 to 5 years. So we know those statistics, and it's not due to poor compliance, because after we stop restricting our calories, some of these hormonal changes, neuroendocrine hormones, can stay altered for up to 6 months after we stop our dieting, basically, and that can encourage the weight regain. So I think it's number one, being aware of these things that go on. So most people will get some regain, but it's not falling into those old habits of the shake diets and skipping meals, and where everything falls over again.
Yes.
Playing the long game. I don't want to live my life like this anymore. I've done it for decades. Healthier, and especially for women going into perimenopause, menopause phase, that they've shown that being more conscious of lifestyle choices, diet, reducing sugar, ensuring you've got fiber, managing stress, that's key to having less symptoms as you transition, and diet and lifestyle is a big factor here.
Absolutely. It's that, not only having your eye on the bigger picture, but also not falling into that all or nothing mentality where it's like either I'm on a diet, slaving at the gym, this is my life where I'm 100% focused. This is all there's room for in my life, versus I'm totally not paying any attention to my diet and worrying about that. And that's usually, so many people have been just vacillating between those two states for so long. It's about finding that beautiful middle space where I can bring these things in, but still live my life in a way that's sustainable. So I love that is such an important focus. And and that you don't, the work doesn't stop after the weight is gone. That's when you get to really start to play with, what is the rest of my life going to look like, I'm curious, because with everything that you're describing and so much hormonal imbalance in the world and stress and all that, we're at the point now where 70+% of Americans are overweight. And we're really seeing the rise of the weight loss medication industry. So I'm just curious if you have any, what your take is on weight loss medication.
Yeah, well, this is interesting because I just had one of my clients ask for her sister about the so I think there's a place, definitely. Like, I used to be all for diet, exercise, and lifestyle therapies, but I've also done a lot of research in surgical weight loss patients, and there's definitely a place, and the results that you can get pretty fast with these therapies. Like, if you're 200 kilos, like, I know you work in pounds, 150
so that could be
sometimes losing weight, or a significant amount of weight in a short amount of time, is not going to be that possible with diet often. Well, it's going to be a lot slower. You can get 30% or more within 3 to 6 months after weight loss surgery. So very good.
I'm curious, especially about the weight loss medications, the semaglutide, the Wegovy, all of the shots and things like that.
Yes. So yes, they have very good outcomes. I've steered, we're doing a project on this. I still think you need to be implementing lifestyle changes. Okay, so what are you going to do once you've lost all the weight? Yes, it's an appetite suppressant. You're going to be eating less, and that's what's driving the weight loss. Yes, they're having very good outcomes in terms of weight loss, 30%, 20 to 30% in some cases, which is almost comparable to weight loss surgery. yeah, I'm a big advocate because I even see in bariatrics, everyone is different in the amount of weight that they're losing, but then they can start developing other poor eating habits where you lead to nutritional deficiencies, you're not getting enough fiber, you're not getting enough protein, the effect that that's having maybe on colon cancer in the future or things like that, or a
Yeah.
lot people
Yeah.
start drinking their calories through alcohol, different unhealthy habits. I think it's still really important that you're learning how to eat more healthy, because if you're not putting good food or fuel in your body, then you're not able to function correctly.
Right.
Okay. So yes, whilst having excess weight is not good for your health, and that's a quick way to get a lot of weight off quickly, I still think it's important to develop healthier eating habits rather than going to McDonald's, having a few chips you're still ultra processed foods. There's a lot of stuff now around that and just the effect on chronic disease. So yes, whilst I think there's a place, like I'm not an advocate for it. If you've tried everything and there's really something wrong, not wrong with you or underlying, yes, I say go for it, but often people just want a quick fix.
Yeah. And I think that's really important. And, I kind of share that sentiment. And actually, I have a group that I work with that are strictly weight loss, medical weight loss people. And what I always tell them is like, look, this is a really special time. You have the help of the medication to be able to restructure and start making those changes, because when you really have those healthy habits and you know how to nourish your body best in a time when cravings are down and all of that, and you're getting the boost of seeing the number go down on the scale, that's the time to really put these things into place. Because otherwise, the research does show too, I believe, that weight regaining the weight is gonna happen when you are ready to stop taking the drug, unless you've got your system in place that supports your body in a way. Yeah. So
They're tools. They're tools,
exactly.
and you get the support, and that's I guess the same with the surgery, medications as well. They're tools to absolutely to start working on some of those things. And now very comprehensive clinical practice guidelines from out of Canada. They're now looking, supporting that, not one size fits all, getting to the root cause. Yes, the eating behavior, the psychology, the genetics, the physiology, you've got to look at all these components, relationships as well. Like these change when you lose weight. What's your social support networks like? Were you happy in your workplace? What's your stress levels? There's so many elements to trying to lose weight and live a healthier life.
Yes, I really love that you're focusing on that aspect. They're tools. They're not a magic pill. Anyone who thinks that they're going to, use this, just get it off, and then I can go and live my life, they're probably going to be disappointed, right? That's the time to come and get into these kinds of programs, get into these kinds of habits, and have the support to take you all the way through. And that's what I hear you saying, and it's so beautiful. So I'm just I could go on all day, and I'd love to pick your brain, because you've got all this wealth of knowledge and science and all the things, but I know that you've got things to do today, and it's bright and early in the morning there in Australia. So let me ask you, I know you have a free gift for our viewers, and so would you please tell us what the gift is?
Yes, so this is the ultimate salad builder. So after sort of years of working with women, and them usually it's like, I don't know where to start or what to eat. This is an amazing tool. It's got 18 done for you salad ideas. Basically, you're working through a step-by-step process to create your healthy salad, that's got your greens, it's got your protein, it's got cheeses, dressings on there, and so you can basically just choose from each column or list
Group. Oh,
and
nice.
create your ultimate salad, guilt-free, lose weight. You know, also there's ideas on how to use your leftovers and still lose weight. So it's just a bit of a fun guide.
Yes.
It's when you don't know what to make for lunch.
Yeah.
It's got protein, fiber, calories all in there. So
Oh,
yeah,
the
easy
practical
to
piece. Like,
calculate.
okay,
Yes.
you've told me all
Yeah.
this great information. Now what do I do with it? This
Yeah.
is what you do with it. You download the gift and you get
Mhm.
started and you notice, how does this feel? And then
Yeah.
get ready for the next step. Oh, this is beautiful.
Absolutely.
Thank you
Yeah.
so much. This is going to be a very valuable resource. So I appreciate that. Yeah, so you guys definitely download the free gift and get connected and learn more from this amazing woman. And Dr. Hayley, thank you for spending time with us. I really enjoyed learning from you and spending time with you.
Yeah, thank you, Laurie, for the opportunity. It's been really great to share my knowledge and yeah, learn more about what you do as well. So
Perfect. All right. Well, thank you. And thank you guys for watching. And I look forward to bringing you the rest of the interviews in this series and for you to start overcoming overwhelm so that you can claim the life that is really meant for you.